Okay, aneurysms mean that we are dealing with a subarachnoid hemorrhage, and the key word here is the worst headache of my life. All right, assuming that the patient does not drop dead and can still survive to come to the ER and describe what happened to you. So there are multiple hemorrhages. Multiple types of aneurysms, as you can see here. And note that berry is because it looks like a berry and not a special name. So these are secular aneurysms, most common. The great majority of the aneurysms, berry aneurysms, involve the anterior circulation or the circle of Willis, where the blood vessels are branching. There are also atherosclerotic or so-called fusiform aneurysms where the blood vessel is basically distorted and irregularly dilated. Mycotic infections are not necessarily fungal, but they are infectious in origin and basically an infection injuring the blood vessel wall resulting in an aneurysm. Dissecting aneurysms versus arterial dissection. Two terms for the sake of completeness and for your future reference. I'm not saying all these to confuse you or throw a whole bunch of things at you to memorize, but these are terms that you will be using or seeing here and there. And of course, we want to use appropriate terminology. So arterial dissection is basically an injured blood vessel wall. Blood starts leaking into the blood vessel layers, and usually between the layers of the media and sometimes between intima and media, just dissecting it throughout. A lot of times, not much may happen, but at some point, there is a lot of blood rushing into the blood vessel wall that it swells and now starts expanding the blood vessel and occluding the wall, occluding the lumen. So at this point, they are termed dissecting aneurysms rather than arterial dissection. In the central nervous system, they are commonly seen in the internal carotid artery and especially are related to manipulations of the head and hyperextension of the head. Sometimes even chiropractors take the blame for it when they do manipulations of the neck, and all these atherosclerotic blood vessels can crack and blood starts oozing into the blood vessel wall. Okay, but regardless, all these hemorrhages from an aneurysm will result in an abrupt subarachnoid hemorrhage. And since these blood vessels are usually at the base of the brain, the hemorrhage will be centered on the base of the brain, not on the top. So that's also a clue that you're dealing with possibly an aneurysmal hemorrhage. Here is an incidental one I came across in one of my autopsies and took the time to dissect out the entire vasculature. So that I can take this picture. Nice little berry-like structure arising from the bifurcation of the MCA and ACA on the left. And I don't see any blood, and there was no blood, and that's an incidental finding. How about the next picture? Well, this is not so incidental, is it? There is a lot of hemorrhage on the base of the brain. The arrow points to a little aneurysm there, or maybe not so little, it's about 1 centimeter. I cannot tell where exactly it is coming from, but you see all the blood on the base of the brain. And eventually, if there is a lot of blood, it will basically ooze out into the subdural space as well by rupturing the membranes.